The Referral Support Service, or RSS, is a service designed to support patients, referrers, hospitals and GP practices when a decision to refer a patient is being considered or made. The Referral Support Service helps to ensure patients are managed as consistently as possible and, if referred, are seen at the right place and at the right time.
So I think the Referral Support Service has made a significant difference to us as GPs in the practice, because it's simplified the process as far as previously having to search through multiple different options as to work out how we wanted to get the patient to the right place first time. It's saved us now, we just have one option. We send the referrals in a practical sense through to the Referral Support Service, and they sort out which specialty clinic they need to get to. And for our staff, that has simplified the process no end, because again, they're not searching through reams of different locations, different clinics, different subspecialty clinics to say, make sure that the person gets to the right clinic first time. It's just made it much more simple. Having the Referral Support Service has meant that there's been far more appointments, patients receiving an appointment, then maybe having that rejected and saying, oh no, actually it wasn't quite the right clinic, you really would be better in this clinic or that clinic. And so there's far less toing and froing of correspondence and patients getting thoroughly confused as to what's going on. Hopefully they get to the right place the first time. I think the RSS has made a huge difference, not just in cutting down the administrative burden and the workload. It's reduced the toing and froing of patients ringing up, confused about what's happening. It's made it much simpler for us as clinicians and referrers, again, in getting the patient to the right place the first time round.
When we get referrals through and we think it's maybe just needs some advice from a consultant at the hospital or a provider, we will go back to our GPs and say, just suggest that they go through and do that route. So sometimes we've really encouraged the GPs to speak to consultants to find out maybe whether a referral is appropriate or not. If a referral isn't appropriate or not needed, or there's things they can try and practice, that saves the patient having to go to an outpatient appointment in a hospital or wherever. So by expanding working with more practices, we're able to gain more evidence so we can see where some of the snags are in the system. It's a very complex thing, the NHS, and trying to just make sure that any little problems that come up across the board are sorted so that they don't happen so often. We're planning to work with other GP practices in the area, and we're looking forward to working with them as we go forward.
It's really about smoothing the patient journey. It's definitely not about managing the referral in any way or blocking referrals. It's about just making sure that the patient does get to the right place at the right time, and if sometimes that includes, maybe a few more investigations in primary care, or where there's a little bit more information that's required on the referral, then hopefully we can facilitate that, and that prevents referrals getting rejected further down the line, and the whole, and the patient, it avoids the patient being bounced around the system. So I definitely think that it's going to change the future of how pathways are created, because they'll become much clearer, I think. At the moment, there aren't always very clear guidelines on referral thresholds, and I think some of those things are getting ironed out. And also in terms of having a strategy for a referral, so that from a commissioning point of view, and also from a secondary care provider point of view, the boundaries and the rules are a lot clearer.
It has benefited us so much. It has been a truly terrific system that you have given to us to help us. It takes a lot of our workload away. It takes away stress, to be perfectly honest, if I do have to say, because there was a time when we had to do all of the referrals, whether it be with the UBRNs, with the directs, and there was just so much paperwork involved, so much time and effort. You have taken all that away from us. And it is just such an absolutely amazing support system, because that's what it is. And we have found it so worthwhile, so brilliant, and I know that anybody who is working the system will agree with me. The typing team, because Dawn has a complete typing team, and they find it, again, it's such a beneficial, helpful, easy system to work. For us, it is just so easy, so beneficial. It works. It's almost like a bit of a dream, to be perfectly honest. So, and it does. It takes away all of those workloads, and we give it all to yourselves. I've got simple clicks to deal with nowadays, rather than 95 different actions that I may need to get to a piece of paper. The other day, I actually did a little test on how well I could do with the referral, still using, of course, quality time management. And I did 10 referrals using the RSS support service in 10 minutes. Previously, that would, with all of the paperwork and every action that I would have to take, those same 10 referrals could have taken me at least 45 minutes to an hour.
All we've had so far is positive feedback. Normally we get the negative first and then positive, but there hasn't been any negative, it's all been positive. Usually we get feedback from the GPs before the RSS service. We would get sort of, why hasn't this referral been sent, and where's the response to this referral, that we haven't had a response yet, it's now been however many weeks. We don't get any of that now. There's nothing. The doctors are doing the referrals, we're sending them, you're dealing with them. Done. Yeah, we've done our own checklist of items that we can utilise within the system, which is really beneficial, which you've helped us with as well. But that can always be passed on as well to other practices. But they will find it so simple, and the time management and the patient benefit from this is huge, huge.